So this year at ASH, we presented results from a phase 2 trial testing the combination of Obinutuzumab and Glofitamab as first-line treatment for patients with high tumor burden follicular lymphoma. Glofitamab is a CD3/CD20 bispecific antibody that's approved for patients with relapsed or refractory DLBCL, but it also has excellent results from a prior phase 2 study in follicular lymphoma. One of the potential downsides of this bispecific is that it was associated with relatively high rates of grade 2 or higher cytokine release syndrome. So in this study, we hypothesized that pre-treatment with 4 weekly doses of Obinutuzumab before Glofitamab step-up dosing began could lower the risk of cytokine release syndrome and also deepen responses. So in this study, we enrolled 35 patients with follicular lymphoma. They had frequent high-risk features. Over 80% of patients had stage 4 disease, and 63% of patients had a high-risk FLIPI score. Among 34 response-evaluable patients, we observed very high response rates with an overall response rate of 100% and a best complete metabolic response rate of 88%, both of which are quite high in this setting. The follow-up is still short, but with a median follow-up around 8 months, only 1 patient has relapsed, yielding a 8-month progression-free survival of 95%. This regimen was also quite well tolerated. CRS was observed in 40% of patients. All but 1 case was grade 1. There was 1 case of grade 3 CRS that was observed in a patient who had pulmonary involvement of their lymphoma and had hypoxia as part of a CRS syndrome. We also observed rare infections. Only about 30% of patients had an infection. All infections were grade 1 to 2. So in summary, this combination seems to be both safe and highly potent, and we look forward to reporting longer follow-up from this combination. In addition, this trial included a separate cohort looking at Obinutuzumab and Glofitamab treatment in patients with marginal zone lymphoma, and we look forward to presenting results from that cohort soon.